You know that despite its popularity and numerous health benefits, garlic is not suitable for everyone? In this video, we will talk about 8 common side effects of garlic and explain why it should be avoided if you have certain health conditions or are taking specific medications. By the end of this video, you will have a clear understanding of when to consume garlic to benefit your health and when it's better to choose alternative products. We will also offer solutions and discuss the proper dosage in some cases. Let's start with the benefits of garlic. There are many simple, natural ways to maintain health if we wisely use what food gives us, and garlic is one of those amazing products. It is known for its ability to lower blood sugar levels, which is especially important for people with diabetes. According to the U.S. National Institute of Diabetes and Digestive and Kidney Diseases, NIDDK, stabilizing blood sugar is key to preventing complications in diabetes. And in this, garlic can be a reliable ally. In addition, it helps to lower blood pressure. A study published by the American Heart Association, AHA journals, showed that regular consumption of garlic helps relax blood vessels and improve blood flow. This reduces the risk of clots, heart attacks, and strokes. Garlic is also a powerful antioxidant. A study conducted by Tufts University in Boston confirmed that allicin and other compounds in garlic fight inflammation, slow down cellular aging, and support the immune system. Garlic acts as a natural antifungal and antibacterial agent, making it a versatile defense for the body. However, just like any potent remedy, garlic has its limitations. Garlic consumption does not benefit everyone. Let's talk about who might be harmed by garlic and why. 1. Gastroesophageal reflux disease, GERD. If you have GERD, that's when stomach acid rises up into the esophagus and causes heartburn. Be especially careful with garlic. It can only make the situation worse. Many people experience a burning sensation, heaviness in the stomach, or even chest pain after consuming raw garlic. This is especially unpleasant when garlic is eaten on an empty stomach or in powdered form. A study conducted by the Gastroenterology Department of the Albert Einstein College of Medicine in New York showed that in 68% of patients with chronic heartburn, symptoms worsened within 30 minutes after consuming fresh garlic or garlic powder. At the same time, baked or boiled garlic caused almost no irritation in the same patients. So if you feel acidity, bloating, or pain after eating garlic, that's an important signal. In this case, it's worth switching to gentler forms of garlic, such as boiled or added to stews. And if even that causes discomfort, then garlic simply doesn't suit you right now. Number 2, blood thinning medications. Yes, garlic thins the blood, and that's one of its strengths, but it's also one of its risks, especially if you're already taking anticoagulants. These could include warfarin, aspirin, clopidogrel, or other drugs prescribed for thrombosis, varicose veins, or ischemia. Add garlic on top and you get a double effect. That means there's a higher risk of bleeding even from a minor cut or bruise. According to a study by Harvard Medical School published in Harvard Health Publishing, when garlic supplements were combined with anticoagulants, 38% of patients experienced spontaneous bruising and nosebleeds. And for some participants, this occurred even with regular doses of garlic, 2-3 cloves per day. What to do? If you're taking blood-thinning medications, avoid garlic supplements, especially in capsule form. And fresh garlic, only in small amounts and only after consulting with your doctor. 3. Digestive issues. This is one of the most common reasons viewers of my channel say they gave up garlic. It causes bloating, gas, and even diarrhea. Why does this happen? It's simple. Garlic is rich in sulfur and fructans, special carbohydrates that cause fermentation in the intestines of sensitive individuals. According to a review by specialists from the Mayo Clinic, garlic is included in the list of foods with a high FODMAP level. These are exactly the types of foods that increase gas formation and irritate the intestinal lining in people with irritable bowel syndrome, IBS, gastritis, and colitis. If you feel discomfort after garlic, especially when eaten on an empty stomach, just change your approach. Consume it only with solid meals. And garlic capsules, take them only after eating so they don't irritate your stomach lining. 4. People with low blood pressure and hypoglycemia. Garlic helps lower blood pressure, and for hypertensive people, that's good news. But if your blood pressure is already low, be cautious. The American College of Cardiology, ACC, in its 2023 clinical review, noted that the active compounds in garlic, especially allicin, cause the dilation of blood vessels, including peripheral ones. This reduces blood pressure, but in people with hypotension, it may lead to dizziness, weakness, and even fainting. Now about blood sugar. If you have hypoglycemia, low blood sugar, garlic may make the condition worse. In a study by Johns Hopkins University, Baltimore, Maryland, it was shown that when consuming garlic supplements, 21% of participants with borderline glucose levels experienced episodes of weakness, sweating, and confusion within 90 minutes after intake. What to do? Start with the smallest doses. Don't eat garlic on an empty stomach, and monitor your well-being closely. If you feel lightheaded, it's best to avoid garlic for now. 5. Patients with autoimmune diseases. Each year, diagnoses such as lupus, multiple sclerosis, or rheumatoid arthritis are becoming more common, and people begin a difficult battle with their own immune system, which essentially attacks the body from within. In this situation, garlic, which activates the immune system, may play a counterproductive role. According to a study conducted by the Rheumatology Research Center at Vanderbilt University, Tennessee, it was found that high consumption of products that enhance immune response, including garlic, may trigger flare-ups in patients with autoimmune disorders. This is especially relevant during remission periods when maintaining stability is critical. Therefore, if you live with such a diagnosis, be sure to consult your doctor before adding garlic to your diet on a regular basis. It may seem like a small thing, but in your case, every small thing matters. Number 6, people with sulfur intolerance diets. There are people whose bodies simply cannot tolerate sulfur. And this isn't just about the smell. Sulfur is present in many foods, but garlic is especially rich in sulfur-containing compounds such as thiosulfates. These substances can provoke bloating, skin rashes, headaches, and even an overall sense of discomfort. A study conducted at the Clinical Nutrition Center of Ohio State University showed that in people sensitive to sulfur, even moderate consumption of garlic, 1 to 2 cloves, led to mild intoxication symptoms, including migraines and skin rashes. If you notice that after meals with garlic you feel irritable, experience intestinal discomfort, or develop skin problems, sulfur may be the reason. Try eliminating garlic entirely for a few days and observe any changes. 7. People with kidney stones. Many believe that garlic has nothing to do with the kidneys, but that's not entirely true. The fact is, garlic contains oxalates, albeit in moderate amounts, but still present. And if you're prone to forming kidney stones, especially oxalate-based ones, it's important to monitor even such sources. A study published in the Journal of Nephrology at Emory University, Atlanta, Georgia, confirmed that even moderate intake of oxalate-containing foods, including garlic, increases the risk of recurrent stone formation in patients with a history of nephrolithiasis. This is particularly relevant for those who use garlic supplements daily. If you've had kidney stones before, it's better to limit yourself to 1 clove of garlic per day and always maintain proper hydration. And remember, no supplement can replace real water. Number 8, breastfeeding mothers. It may seem that garlic and breastfeeding are unrelated, but some mothers notice strange behavior in their baby after a meal that included garlic sauce. Fussiness, refusal to nurse, crying. A study conducted by the Pediatrics Department at the University of California, Davis, showed that in 38% of infants, the pattern of nursing changed within 2 hours after their mothers ate food rich in garlic. This is because compounds from garlic do pass into breast milk and alter its taste and smell. If you're breastfeeding and suddenly notice that your baby is refusing to nurse, try a simple experiment. Remove garlic from your diet for a couple of days. It might have been the cause of the issue. Now about the dosage. This is where even those who know about garlic's benefits often stumble. Let me say it right away. No capsule, no powder can replace fresh garlic. But even fresh garlic needs to be dosed properly. A study conducted by the Center for Complementary and Integrative Medicine at the University of North Carolina showed that the optimal daily dose of garlic for an adult is 1 to 2 cloves per day. When this dose was exceeded, 25% of participants experienced side effects, digestive issues, dizziness, and irritability. And one more rule, do not eat garlic on an empty stomach. On an empty stomach, it becomes too aggressive, and instead of a benefit, it can have the opposite effect. Boil it, roast it, add it to dishes, but don't overdo it. Garlic is power, but but power that must be used wisely. And remember, a healthy food can become harmful if it simply doesn't suit you. Listen to your body, consult your doctor, and stay healthy. If you have any questions or something to say, leave a comment. You'll find more information on this topic via the links in the description under this video and on our channel.